This is Dr. Ronald Ritchie talking to you today about healthy mom and having a healthy baby. And this is how chiropractic and pregnancy work together. Let's look at some statistics. They are a bit boring, and these statistics are a couple of years old, but not terribly old. And really, in the recent few years, these statistics really haven't changed much. First of all, there are approximately 6 million pregnancies in the U.S. every year. Of those, 4 million are live births. If you do the math, well, that tells you that 2 million pregnancy losses occur every year. They are predominantly due to miscarriages, ectopic pregnancies, and a few other conditions, but also termination of pregnancy. Common complications in births, well, here's some more of those boring statistics. About 875,000 women will experience one or more pregnancy complications. Babies are born to mothers without adequate prenatal care. About 500,000 of those 6 million. About 500,000 babies are born prematurely. But it's really interesting is that even with 300,000 of those babies born with low birth weight, there are still a lot of babies who are born prematurely and have low birth weight that come into life and succeed. Another unfortunate statistic is that there are about 150,000 children born every year with some form of a birth defect. And that unfortunate statistic is a growing statistic. Well, common problems that occur with pregnancy. Well, here's a long list. My goodness. But guess which ones are right up on top? Back pain, body image problems, constipation, tiredness, headaches. These are way up on the top of the list. And there's treatments for all of these in one way or another. Let's look at some of the major ones. Heartburn and indigestion are a very common problem. As a matter of fact, heartburn and indigestion for no justifiable reason is one of the first signs of pregnancy. And that's especially true when that occurs with persistent nausea. And that's usually one of the very first signs that women think, uh-oh, there's something wrong, and they begin to think, when was my last menstrual period? And all of a sudden, you now have been diagnosed by yourself to know that you're pregnant. Well, this usually begins around the 6th gestational week. So that's pretty early in the cycle, and it can occur at any time of the day, and usually occurs in the morning, hence morning sickness. But I tell you what, I have known women who have had this occur every single day of every single week of their entire pregnancy. Well, usually though, that morning sickness stops around the 12th week, but it may continue, but without the nausea, mercifully so. It is thought to be a result of the neurohormonal changes and nutrient demands that occur as a result of the pregnancy, but no one really knows exactly the cause for that morning sickness other than these few very broad factors. Well, there are a few do's and don'ts when it comes to nausea and heartburn in pregnancy. The first thing you want to do is eat small meals more often, drink more fluid, and fluid I don't mean by coffee and sodas and things like that. And you want to drink water, fruit juices, diluted sports drinks, things like that. The other thing is that soda crackers, because the carbohydrate of the cracker absorbs the acids and enzymes of the stomach, that can help. Sometimes women get really bad indigestion and heartburn and nausea when they're trying to cook, because just the smell of cooking food can trigger more nausea and heartburn. And that's even when the foods that they're cooking are foods that they enjoy to eat, which is very interesting. It's a neurologic trigger of those olfactory membranes in the brain and sending signals down into the brain, and it just triggers off that nausea. Here's a good one. Ask somebody else to cook for you if it bothers you too much. How many of you ladies out there can get somebody else to cook for you when you're pregnant? Not very many. Well, the other one here is plenty of rest. Avoid very warm places. Although you're not having hot flashes, being warm, and especially warm and humid, can really trigger a lot of further nausea. Exercise actually decreases nausea and the indigestion, because there's something about the physical activity and how it triggers endorphins in the brain that helps alleviate some of that nausea and upset stomach. And then there's some simple things like drinking lemonade, eating watermelon, chewing on a lemon, or even sucking on a piece of ginger root that can often very much help in relieving a lot of that nausea. Well, what are some of the don'ts? Well, some very simple ones. Don't lie down after eating, because lying down after eating pushes that food up into the stomach and causes reflux. The other one is don't skip meals. Even eating a small meal frequently will help. And then don't cook or eat spicy foods. Now, that's a general rule. I've known some women who've eaten spicy foods and they say it helps. So that's up to each person, but eating spicy foods and staying away from those is usually a good help. What's another condition? Back pain and sciatica. That is probably one of the most common. 70% of women will experience back pain and or sciatica. It may have that sciatic leg pain and it may not. Usually it begins in about the second trimester, although it can begin at any time. And the reason why it begins at that second trimester, baby is now big enough to start causing some pressure in the lower pelvis and the lumbar spine. And there are also some hormonal changes that are going on that actually can add to instability of the sacroiliac joints and the lumbar spine that can actually help cause more back pain. It varies in intensity and location from woman to woman. That's because everybody's different, and it depends upon the mother's general health and level of activity. I can honestly say that more sedentary women will have more back pain, and more physically active, especially if you do exercise early in your pregnancy, it will alleviate much of the back pain and or sciatica that can occur. Well, what are the causes of back pain? What causes it? Well, here's a nice illustration I found that really is really demonstrative of the physical changes that you can see. And you can see here what happens to general posture as time goes on. Baby is right out here, really pulling forward on that lumbar spine, pulling forward on the pelvis. It creates strain on the knees, strain on the feet, strain on the shoulders, but especially right there in the core of the lumbar spine. You can also see, if you look at her face and her arms, you can see the weight gain that has occurred, not just because baby's getting big, but because of the fluid accumulation that occurs. Look at her feet. You can see it right in here. You can see that there's some changes going on that are fluid related. Well, biomechanical changes, the additional weight. If you've had back pain before you became pregnant, then it's very likely you will have back pain during your pregnancy. And those biomechanical things is just the baby and the baby's position and just that extra 20 pounds that's pushing forward on the pelvis and lumbar spine. Muscle tone issues, and this is where exercise comes in. If a person didn't exercise well and their muscles were already kind of weak because they're a couch potato, and then you get these biomechanical changes and the extra weight and the fluid dynamic changes, well, it just makes that strain on the low back and the pelvis and knees a lot worse. Fluid dynamic issues. That is a big problem, because what it will do is it will make the muscles weak, it will put extra strain on the lumbar spine, and just the extra fluid being carried around because of a lack of good exercise, rest, and diet, that will cause a problem. Believe it or not, a woman who is pregnant can carry an extra 15 or 20 pounds of fluid only around on them. And then hormonal changes. That one right there, you can't really do a whole lot about it. Those hormones are going to change because you're pregnant, and the hormonal changes have a lot to do with the tone and elasticity of ligaments, which directly affects the stability of the lumbar spine and the pelvis. And then good old ordinary stress. My goodness, there's a whole bag of worms right there. Stress isn't necessarily a problem on its own, but boy, if you have anything going on in your life, any health issues, any problems, stress will just zone right in on that and make whatever existing problems you have much worse. So I'll say this, not really being sarcastic, but if you can really lower your stress level by learning how to deal with stress, by learning how to become more comfortable and peaceful, then that really helps a great deal in the genesis of back pain, headaches, and a lot of the other issues that go on during pregnancy. Well, and that brings us up to headaches and migraines. Well, 80% occurrence of headaches and migraines during pregnancy. It is most common during the first and third trimesters because it's during those two trimesters the greatest amount of neurohormonal activity is going on. In the first trimester, there's hormonal changes, there's blood volume changes, blood sugar gets low, caffeine withdrawal, because now all of a sudden women are trying to change their diet and improve their diet, so the withdrawal of caffeine, the improving of diet and lowering the sugar intake, that's going to trigger headaches. But I'm saying it's a good reason to do those things because you want to make a healthy baby and you got to keep yourself healthy in order for your baby to be healthy. A big one here is lack of sleep. Women who don't get enough sleep because they don't deal with stress well, or they just can't get comfortable, or there are other factors going on. If you're not sleeping well, you're going to have a lot of headaches and migraines. And that's especially true during the first trimester. During the third trimester, that lack of rest is also there, but edema, swelling, and postural tension and strain are really a major problem in causing headaches and migraines. I have to throw one note in here, though. I really, really do. When it comes to headaches and migraines, if you have headaches, especially if they're migrainous, with throbbing and pounding and blurred vision and nausea and dizziness, that is a really strong indicator of the potential for preeclampsia and other things going on. So if that is something that is occurring, don't just try to deal with it on your own by taking a whole lot of Tylenol or having your neck rubbed or your back rubbed. You need to be sure that you don't have one of these conditions going on, because this threatens not only the life of the baby, but your own life. Well, what do we do about it to treat these things? Well, the first thing is avoid the common triggers of migraines. Chocolate, alcohol, yogurt. Isn't that interesting? Because of the culturing process. Aged cheese, because of the culturing process. Interestingly enough, trigger for headaches and migraines is peanuts. Breads with fresh yeast, preserved meats, and sour cream. All these because of the curing process or the culturing process that goes on within them. Except for that first one, chocolate. There's no curing that's done there, but the chemicals in chocolate very often are a common trigger for migrainous headaches. It's also interesting that during pregnancy, what is a major craving for many women? Chocolate. Kind of a catch-22 on that one, but it's the truth. Constipation and hemorrhoids. Boy, there's another common problem. Constipation affects about 50% of all women to some point or another, and 20% of all women will develop hemorrhoids as a direct consequence of their pregnancy. Well, what's the cause of constipation? Well, number one, emotional worry and anxiety. But minimal physical exercise, low-fiber diets, and other substances are a major cause. That's why exercise, as soon as you know you're pregnant, even if it's moderate, mild, lightweight exercise of just walking and on a treadmill or riding a cycle, it needs to be some form of exercise, because that will prevent constipation during the latter half of the pregnancy. Low fiber diets. Boy, here I can't emphasize enough the importance of fruits and vegetables, fresh fruits and fresh vegetables in the diet. And by that, you notice I left out grains and cereals. That's because we put a little bit too much emphasis on eating grains and cereals as the only source of fiber. Unfortunately, there's a lot of soluble fiber in those grains that act like a sponge to soak up water, but it also acts like sticky paste and sticks to the GI tract and actually slows things down. So fresh fruits and fresh vegetables are a much better source of those insoluble fibers that prevent constipation and hemorrhoids. And then also, here's another biggie: excessive iron intake. That is something that is a big problem in the U.S. And there actually are several medical associations that have put out bulletins to physicians telling them to instruct their patients, don't take so much iron. Iron deficiency is not usually a significant cause of anemia. There are other issues that are involved, like vitamin B12, folic acid, copper intake, and other things that are much more important than increasing the level of iron in and taking an iron supplement. Matter of fact, most iron supplements, especially the ones you buy over the counter at your local grocery store or at the local big basket store, is actually something that's called ferrous gluconate. When that gets into your GI tract, there's so much iron there that it oxidizes, it turns into rust, and that's what makes your stool black, is because most of the iron never gets absorbed. It just turns into rust and constipates you terribly. So don't do that. There are much, much better and more effective ways of dealing with anemia than just taking an iron supplement you get at your local grocery store. Insufficient fluid intake is a significant problem, and in some women, too much fluid intake actually can cause more swelling. So that issue is something that needs to be directed by a physician. Well, what is the treatment during pregnancy? Well, things you do not do is take a bunch of laxatives. You don't need to do that. This is something that used to be done in the past, and that was mineral oil. You don't hear much of people taking mineral oil to deal with as a cathartic, and it's really good that people don't use that anymore because it's really bad for you in so many ways. But laxatives are not recommended. What you do is you go back up here to a high fiber diet, eating lots of fruits and vegetables, getting that fluid intake right, not taking iron, and making sure you do some level of exercise to help improve the tone of the muscle of the GI tract. Leg cramps and swelling are another major problem when it comes to pregnancy. Almost 50% of women will experience some form of muscle cramps and leg pain or back pain that is related to muscle spasms. Common causes are electrolyte or mineral demand changes, and that is, baby gets first choice of all the nutrients, and what that does is it makes your body deficient in minerals because baby's sucking it all up. What that simply means is you have to increase the mineral content in your foods. The additional weight gain and changes in circulation and blood flow and pressure on from the baby on nerves and blood vessels in the lumbar spine and the lower abdomen are very, very significant factors which have to be addressed by the doctor. Well, how does chiropractic help? I know I didn't cover that entire list on the different problems, and we would have to make a very, very long video to be able to do that, but let's talk about how chiropractic can help. Well, first of all, the manipulation of the sacroiliac joints, the lumbar spine, even the extremities like ankles and feet and knees help tremendously. It has tremendous benefits on joints by improving their overall movement. It relieves pressure on those joints and aligns those ligaments and tendons that hold those joints together, and it keeps things in alignment for optimum function. It also has good effects on muscles. In my office, I use a muscle stretching technique on pregnant women to help keep things flexible, keep things mobile, keep things relaxed, so that there's good symmetry, there's good tone, so that when it comes time to deliver the baby, Baby's got a really good opportunity to be efficient in that delivery process, and mom experiences less trauma to her body because all the biomechanics and flexibility and tone issues have been addressed in preparation for this process. Also additional benefits, and those additional benefits include nerve effects. When you do adjustments to the spine, there is tremendous impact on the central nervous system. There are a number of firing of both upper and motor neurons that have stimulatory effects on all kinds of nerve functions, and especially directly in the lumbar spine, relieve pressure from the nerve roots in that low back. Hormonal effects. It has a reflex impact in the central nervous system to balance those hormones that are being produced normally during that pregnancy process. Lifestyle changes are very, very, very important. I can't emphasize that enough. Improving overall activity is tremendously important. You can't forego that. It must be done in order to keep yourself healthy and to keep your baby healthy. There's dietary changes that need to be done. As I've already talked about, the proper foods to meet a person's demand, and every woman's demand is slightly different because every single person is different. What is that person's previous health history? What has their activity been like? What is their general diet like? What is their family history to address certain background issues that need to be taken care of in order to make that woman healthy and that baby healthy? And there's specific supplements that are needed for specific needs. I don't know if any of you have heard about it, but there is an essential fatty acid, or a fish oil. Fish oils are primary source of those essential fatty acids, but it's called DHA. DHA is tremendously important for neural tube development and nerve development in a fetus. And I'm talking about DHA within the first few weeks of pregnancy, not in the last trimester. We're talking about at the beginning of the first trimester. So there's many, many things in addition to iron, not getting too much, but making sure you have enough. And then there's a lot of other things too that are necessary. Exercise is very important, general cardiovascular exercise, and a exercise I hardly hear any OB talk about anymore is called the Kegel exercise. That's a very funny, strange exercise, but it's designed specifically to improve the muscle tone of the perineal floor. That is the bottom of the abdominal cavity. All those muscles and tendons that the baby is sitting on, those muscles can be exercised in order to improve their tone, their strength, and their ability to be flexible and deliver a baby with less problems. And then lastly, rest. Oh my goodness, 8 to 9 hours of rest a day. If we could only get that on a regular basis for everyone, that would be absolutely tremendous. Well, that's all I can tell you right now in this short little presentation, but I'm always available. My phone number in my office is 972-496-9800. If you have a question, you feel free to call me. I'll be able to at least give you a direction in the right way to help address any specific issues that you have. Or if you're near my office in Garland, Texas, out near the Firewheel Mall, then come by, drop by, and stop by, and I'll be happy to talk to you about what's going on and what are your needs. This is Dr. Ronald Ritchie talking to you about being a healthy mom to deliver a healthy baby. Take care and good health.